Hi there, I'm Dr. Stephanie Falk, and today I want to talk about two things that I think that we can do to alter our thinking to greatly dissipate anxiety in our life. It's particularly true, I think, for those struggling with generalized anxiety, but I think for all of us, it can do us a world of good in terms of just mitigating some anxiety and stress that we live with day in and day out. So I actually lied. I'm going to talk about one of those things today and one of these things next week. And so what are those two things? Reining in our what ifs and making more constructive meaning out of events. So the first one, what ifs. What are what ifs? What ifs are hypothetical, future-oriented events that we ascribe a negative outcome to. But they're things that haven't even happened. And what happens is we ascribe a negative outcome to a what if, and then we live as if it is actually true. And so we go through a bunch of emotion as if our what if is true, when really it's not in the here and now at all, and it might not ever even happen. And so let me use an example to kind of illustrate the point. And I recognize it's kind of a sensitive example, but it's something that I have seen a number of times, and I think that it really illustrates the point. So say that I have a bump on my arm. What do I know? I know that I have a bump on my arm. What people tend to do is they ascribe the most negative outcome and meaning around that bump. So for instance, someone might think, okay, so I have this bump and it has to be a tumor, and it has to be a malignant tumor, and it has to mean that I'm dying and I'm not doing well. And so what happens is they set up an appointment with their doctor. Maybe it's 5 to 10 days out. And so for 5 to 10 days, they walk around living as if that what if is actually true. And so they feel frustrated, they feel angry, they feel sad, they feel desperate. How do you think that impacts day-to-day life? Significantly. It impacts the way they feel about themselves. It impacts the way they feel about their future. It impacts the way they relate to people. But then they go to the doctor 5 to 10 days later, and they find out that actually this bump on their arm was just a bug bite. It was something that they got in the middle of the night, and their doctor says, you know what, I'm glad you came in. No need to worry. It's not really a big deal. It's going to go away on its own. And so usually that person has a deep, big sigh of relief. But they could have spared themselves that gamut of negative emotion and sadness and frustration and anger for the last 5 to 10 days if they had just lived in the moment. What they knew about their arm is that they had a bump. They had a bump. I think we could all do well to live as if we had a bump rather than ascribe a negative outcome to an event that hasn't actually even transpired. So what are some other examples of what ifs that might apply to you? Maybe someone doesn't want to go to the gym because if they go to the gym, they're going to be teased. Maybe they don't want to try a new restaurant because they're worried about parking and finding a parking space. Maybe they're worried about asking someone out because they know 100% that they're going to be rejected. And so these are just kind of some potential what ifs. And what happens is if we hang our hat and live as if the what ifs are true, then usually we immobilize ourselves. And so I'm not suggesting that we bury our heads in the sand and we don't look at a bunch of different potential outcomes for a related event. So if you ask someone out, they may or may not say yes. They may say maybe, they may say no. So no and getting rejected is a potential outcome. But if we hang our hat on that idea that that person is going to say no, it usually impacts us in a really negative way. And sometimes actually we end up manifesting that reality. Because if we think someone's going to say no, do we approach them with confidence? Do we approach them with warmth? Typically not. So we need to really be careful. I think that the best thing that we can do is actually try to live in the here and now and trust ourselves to make good in the moment decisions. Life comes with some risk. Sure, as we go to a new restaurant, it might be difficult to find a parking spot. As we go to the gym, maybe someone might look at us at the gym. If we ask someone out, they might actually say that they don't want to go out with us. Those are potential outcomes. But I think the best thing that we can do is to say, you know what, I'm going to live in the moment. I'm going to make the best decision that I can. And if there's a negative outcome, then I'm going to set myself up to deal with that in the best possible way because I know I made a good decision in the moment. So I hope I've encouraged you to try to identify what are your what ifs that you kind of live beneath and how you can rein those in and trust yourself in making good in the moment decisions. I appreciate you tuning in. Next week, I'm going to talk about making more constructive meaning making, which is that other thinking tool that I talked about that I think can really dissipate anxiety. If you don't want to miss a video, feel free to subscribe. And I hope this finds you having an absolutely beautiful day. Thank you.